Shaking hands don't always mean Parkinson's disease. Another cause is essential tremor, which affects up to 10 million people in the U.S.
It's very different than Parkinson's. Parkinson's also has a tremor, but it's a different kind of tremor.
Dr. Darlene Lobel is a neurologist at the Cleveland Clinic.
Essential tremor is a neurological disorder that causes patients to shake when they're performing an activity. So they don't shake when their hands are sitting in their lap, but if they grab a cup of coffee to drink it, they'll start shaking, or if they try to write, they'll start shaking. Parkinson's patients, just with their hands sitting in their lap, they'll start shaking. Also, Parkinson's patients have stiffness and slowness of movement. It's hard for them to get up out of a chair. It's hard for them to even walk.
So, why don't we hear much about essential tremor?
Essential tremor runs in families. So a patient may start shaking when they're performing a movement, but they say, well, my mom started shaking when she was in her 50s, so that's just what happens when you get older. Okay, the second reason is actually very interesting. It goes undiagnosed by a lot of doctors. And you may say, how can a doctor not notice when a patient is shaking? Because the tremor only occurs when they're performing a movement, they can literally sit in a doctor's office for a half hour, their hands folded in their lap, and a doctor could never see them shake.
Essential tremor can affect the legs too, as well as the head and voice.
It most commonly presents in the 40s. However, I've had patients come in and say that they've started shaking as early as their teenage years. A lot of times, though, it's not severe enough to bother them until they really get in their 40s or 50s.
Medication works for about half of patients. For others, surgery is an option.
So we call it a brain pacemaker. Now the surgery is called deep brain stimulation, or DBS, and it involves placing tiny electrodes deep inside the brain in the area that'll help control their tremor. The way it works is essentially the way a heart pacemaker works, so it helps those cells to fire normally.
Deep brain stimulation reduces tremors by up to 90%.
Not every patient with essential tremor needs medication or surgery. It's only those patients that it's really affecting their quality of life. So an individual who's having trouble getting dressed in the morning because they can't get their buttons together, or they're at work and let's say they have to use a computer frequently, so they can't type very well because of their tremor, these are patients that we really want to come in for evaluation and treatment. There's one other thing that's very important, and that is the social aspect of essential tremor. Now, if you think about if you had a tremor and you were going out into a restaurant, trying to cut your food or eat soup, that can be very embarrassing, and that really causes problems for a lot of these patients. That in and of itself is a reason enough for a patient to come in for evaluation.
For Fox 8, I'm Dr. Mark.